We're here for the Border Health Caucus conference in Washington, D.C. That's why we're here. We're here to address the healthcare needs along the border.
The reason we do the meetings here in Washington is so we can talk to the representatives, senators, and everybody that is kind enough to hear us of all the problems that we have in the border.
You're right, we do right now.
The benefit is that there are more legislators here than along the border. We do it alternately, once 1 year here, 1 year there, and we have good responses on both, but we thought this would be a good approach, and we've actually had more in Washington than along the border.
They have some unique problems, and as we attempt to solve those unique problems, working together with legislators and other individuals that are stationed here in Washington, it just makes things work much better for everyone to come and visit. And when we're all thinking together, we tend to come up with better ideas.
It's exciting to be here with doctors who are ready to learn how we can all work together, not them from us, but so we can learn from those physicians that have come up here for one common goal, and that is how do we improve the field of medicine, not only for the state of Texas, but especially for the border area.
The border region is extensive. It's a 2,000-mile geographic area that spans, it's one of the largest international borders.
Providing health care along the border is tough. It's hard. It's much of it is rural, as you know, and finding specialty care for populations is really difficult at times.
I think border health issues are kind of it's almost like the canary in the coal mine, because a lot of issues happen there first.
And I always say that if there's a problem on the border in Texas, it will be in Houston this afternoon.
I see a lot of the same problems that they have surfacing in East Texas, in rural East Texas. And we have to work on those problems to solve them, to take adequate care of our people.
Is an area that has really grown these last 20 years. We've doubled in size in population, and we found ourselves with about 40% uninsured. And I'm pleased to tell you that 40% has dropped down to 20%.
I want to see us working together to really have as much access to health care as we possibly can.
El Paso and Juarez is a perfect example of the important things that are happening along the border, how it's not two communities, it's one community that is separated by an international boundary.
Good policy comes from good dialogue. You can't have dialogue unless you're present.
And I'm here not just to talk, but to learn. And one of the things that I learned from talking to the students today is that one of our big challenges is we don't have enough graduate medical education spots in communities like El Paso.
Because the next step in our career is, graduate medical education, which is residency. So we want to make sure that there are spots out there that we could go into.
And there's a lot of information coming our way, but very little going back the other way. Is there any plans to try to do more collaboration?
You're absolutely right. In some communities, I think that we're doing that well, but in other communities, we could certainly do much better.
So I don't want people to walk away with the feeling that this is only about border health. It's not just about border health, but certainly I think the problems that we see along the border are the problems that we see in every part of our state. And if we take what we learn here and can come up with solutions, we can apply them everywhere. Everybody wins.
We hope you take some of our concerns and apply them, think about them. Like we say, whatever is going on in the border right now is going to happen further north very quickly.
Y'all get coffee and stuff, and we're going to